Breast density is an important topic for females. Breasts are made up of fibrous, glandular, and fatty tissue. The amount of each tissue determines the density in the breast. Density can be detected during a mammogram by a radiologist. Fibrous and glandular tissue appears white on a mammogram, or more dense, while fatty tissue appears dark, or less dense. The Breast Imaging Reporting and Data System, or BI-RADS, is how the radiologist reports your density. Breast density has 4 categories, scaled A through D. Category A means the breast has mostly fatty tissue and very little fibrous and glandular tissue. Breasts in Category B have scattered areas of fibrous and glandular tissue, but mostly fatty tissue. In Category C, the breast is heterogeneously dense and has a mix of fatty, fibrous, and glandular tissue. Finally, in Category D, breasts have extremely dense tissue with little fatty tissue. High breast density is common. More than 50% of females have dense breast tissue, and you cannot tell if you have dense breasts by their fill or size. There are a number of reasons why it is important if you have dense breasts. First, it is a risk factor for breast cancer. Second, both dense breast tissue and breast cancer may appear white on a mammogram, making your mammogram more difficult to read. This does not mean that you should not get a mammogram. You still need one. Individuals diagnosed with dense breast should continue to get regular screening mammograms, but there are additional screening tests that can help doctors detect tumors that may not be identified by conventional mammography, such as breast ultrasound or breast MRI. If you have dense breasts, talk to your doctor about the benefits and risks of supplementary screening tests, in particular if you have other risk factors for breast cancer. In 2022, Ohio passed legislation that expanded coverage to breast cancer screenings for those with Medicaid and commercial health insurance to make it easier to get your necessary screenings. This legislation allowed for coverage for annual 3D mammograms regardless of age, as well as coverage for supplemental breast cancer screening, such as breast MRI or ultrasound, for adult females who are at increased risk for developing breast cancer. This includes individuals with dense breast tissue. At Summa Health, if you have increased breast density as identified on your mammogram, you will receive a notification letter informing you that your breast tissue is dense. This information is given to you to increase your awareness and help inform conversations with your doctor about whether additional screenings are appropriate based on breast density and other risk factors for breast cancer. For more information on breast density, please visit summahealth.org/breast density.